Welcome to the March Board of Health meeting. I'm so glad to see you all and celebrate the great comments on the vaccinations for what the Board of Health is doing, what the Health Department is doing. It's just wonderful to see those comments and really realize that other programs are still working. So thanks to the staff for that. You have in front of you two approvals. The first are the Board of Health minutes for February 3rd. May I have a motion for their approval?
Motion to approve. Ken Edward.
I didn't catch who did that.
Ken.
Ken, sorry. Okay. Ken, motion to approve.
Ray will second.
And Ray second. Is there any discussion on the minutes? Just thanks to Kim for doing them. All in favor, say aye.
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 Opposed? Motion carried. Lisa, are these your last vouchers you're doing for us? You're on mute there. If you could just tell us about the boxes here.
Yes, this is my last list. And there's one item of note. There's a $41,000 payment for our annual maintenance for the Patagonia billing software. So that is the only item I think of note, unless you all have any questions.
Are there any questions from the board on the expenses? All right. May I have a motion to approve the vouchers, please? Ken is motioning, and is there a second?
Second, Vanessa.
Okay. Vanessa, second. All those in favor?
Aye.
Aye.
Opposed? Motion carried. So no resolutions. That's amazing. So
It's amazing.
all right. So Guy has to have one of the records of being the longest serving epi, doesn't he?
Probably pretty close. So I know Guy will be joining us. He might not have gotten on just yet. So we might want to just move forward on the agenda and we'll get him when he joins.
Okay, sounds good. So we move on to Lisa and the monthly financials.
Your packets contain January statement, so 1 month of actual. Not a whole bunch to talk about here other than COVID, of course. State and federal grant revenues, which should even out to be about 58 to 60% of our overall funding, totals 395, almost 396,000 for the month of January, which is about 1.4% over budget, and 108,000 favorable to last year. COVID-related revenues, and remember these are cash basis revenues at this point in the year, totaled 78,000 in January. Just as an overall reference, COVID awards to date, including last year through what we know about this year, is about 2.7 million, and we've got about 1.9 remaining in funding for the 2021 response. Permits and inspections are under budget. The budget is an average over the year, and January is a really light billing year for permit or billing month for permits and inspections. Medicaid, so clinic revenues are under budget. $9,534, which is about 60% under last year by 8,800. Again, COVID related clinic focuses on vaccinations right now. Medicaid Title 19, we received 4 payments during the year. So that's again a timing variance, over budget 29,000. On the expenditure side, before county allocations, we are under budget 15%, 91,000, almost 92,000. But over last year, 104,000. Most of the variance is in the personnel related, both fringe and salary, which are under budget 49,000, which is about 9%, and over last year, almost 114,000. COVID staffing and fringe, which includes existing and new staff, totaled 120,000 for the month of January. Overtime was 24,000. Temporary help of a little over 9,000. In January, we had 85 staff, including 7 temps and 78 full-time staff. The fringe rate was budgeted for 2021 to be around 51%. We're under that at 49%, so we're still favorable to that rate. Most of the rest of the expenses are timing related. There's one item on a membership line for some annual dues. The biggest one in that category was our mouth dues of $5,000. On the fund statement side, so again, it's January, so I'm trying to project out what I think the 2021 year should look like. I have factored in any new COVID funding that we've been notified of and accommodated increases in overtime and comp time for COVID response activities. Overtime is averaging about $8,000 a week right now. So I projected that out over the full year. And again, also temps, we budgeted at about 62,000. I think we're going to come in over that. Remember, we were doing the budgets in August and September. So we've definitely received new information on funding. So I've tried to basically factor that in. I think we're on running well against budget. I'm not seeing any problems. Any questions?
I always appreciate how easy it is to understand your reports. I really do.
Well, thank you. And I just if I can take a moment, I want to thank you all for all of your support and encouragement. It's been really an awesome 3 years. I hope I've added something to the presentations. It's been a challenge at different points, and it's really been an honor to serve this board and to be a part of this organization. It's been, I'm really proud of having been a part. Thank you.
We appreciate all you've done and gonna miss you.
Yes.
Yeah, sure.
I'll be back. I think I'll volunteer, or you just never know when I'm going to show up.
We're going to
gonna
add you to the volunteer list now.
Yay.
Lisa.
Yeah, that's
Yeah.
right.
You're on record.
Yeah.
Uh-oh.
Oh, that's great. Thank you so much, Lisa. Be well as you go forward in life. So, Guy, I see you popped on. 5 years. That's quite an accomplishment through this rocky times. So, congratulations.
Yeah, thank you, Peg. I mean, I never anticipated being an epidemiologist during a pandemic, but here we are, right, Nikki?
Yeah.
It's a resume builder.
Absolutely.
Courtney, do you want to share a few words?
Yeah, I'd love to just say a few things. I've been able to work with Guy now almost 3.5 years, so many of his 5 years here. And I think some of the things that you are all very familiar with his work, so this will not be news to you. But Guy very much values quality improvement, and I really value that in him. He is always looking for ways to build efficiency and how can we do what we're doing even better. And I value that he always pushes forward and looks for that. He has really in the last, handful of years stepped into so many different leadership roles. And I think the pandemic especially has elevated a lot of that, but he has really stepped up and worked with our Berrien County Human Services Coordinating Council. I think they very much depend on his involvement and updates. Of course, over the years has helped with the farmer's market. And one thing about Guy is he is always willing to step outside of what you would think is that traditional epi role and find where he is most needed to serve our department and truly to serve our community residents. He values that immensely. In the past year, really supporting our skilled nursing facilities and our testing coordination. I think he early on took, I don't even know how many calls, guys, from skilled nursing facilities, from physicians, from laboratories. He was the 24/7 contact for a long time, and I think got some really weird time calls and just took on all of that and really helped our partners. And I think that is immeasurable. And then really with that too, case investigation. I know Candy would say this too, and Donna, but Guy has been really involved with our case investigation. Again, valuing that efficiency of process and making sure that we are doing our work in a way that is doing all of the things, but also taking care of our staff and building those efficient processes. And I think he has really excelled in being able to help with that. And then just overall, Guy, you care about our department and you care about our community. I think a lot of times he is always just looking for how can we do our work in a way that better serves our community. He is definitely a leader among our staff. A lot of our staff really look up to Guy and value his involvement in the work that they're doing. And I think that's really cool to have him in that role too. So thanks, Guy.
Thank you, Courtney. Appreciate that.
If I could just add to that too, I mean, some of the other things, I mean, team is clearly very important to Guy. And as Courtney was saying, a lot of our team looks to him for leadership and involvement and those sorts of things. But there are some people in your organizations that just really contribute to the heartbeat and the culture of that organization. And Guy is definitely one of those people. He values his relationships with his coworkers. They value their relationships with him. And those are some of those indefinable qualities that you don't always know what you're getting in a job interview setting. And, you know, thinking back to the first time I met Guy was during his job interview over 5 years ago. And those are some of those indefinable qualities that you hope for in candidates and you think you start to see. And we're really grateful that we've reaped the benefit of having Guy here for the last 5 years. So thank you, Guy.
Johansson,
Thanks,
I'd just like to say to Guy and to the rest of you, I know things about Guy that none of the rest of you know. I was his pediatrician for years. He's given me okay to say that. And so I know him when he was a little kid. And to have him working here has been spectacular. We've grown to be great friends, besides all the hard work. And I echo all the things that were just said about him. They're all true. And he's just an absolutely great guy and such a terrific addition here. So thanks a lot, Guy.
Thank you, guys. That's incredible.
Thank you so much for serving. We really appreciate it. So,
Yeah, my pleasure.
And stay around for a while.
yeah.
Yeah.
Oh, wonderful. Well, thank you very much.
Yeah, congratulations, Guy.
Yeah. We'll move on to the administrative reports.
Yes. So as we've been doing for the last several months, I'll kind of get us walking through and then we'll hear from others along the way. So I'm going to actually share a PowerPoint that we'll move through here. So as we need to, we're going to start looking at the data trends and transmission. There's a couple of graphs here just showing where we've been throughout the course of the pandemic. And you can see, I mean, we're right here right now, and that we are actually at levels approaching where we were over the summer in terms of number of new cases that are being reported on a daily basis. So our average number of new cases per day is about 17. A far cry from where we were at this peak of 167, 168 new cases per day. So we're very grateful and encouraged by this continued decline. We want to make sure it stays that way. We are, as is our role in public health, continuing to monitor just what's happening with variants and what's going on. But we're very encouraged by what we're seeing in the data that continues to be reflected in the percent positivity, that we're down at about 5% now. So we're, again, sustained decrease for a few months now. And that has been really good and encouraging We're also seeing the same thing in the hospital. So this top graph is the average 7-day rolling average census for people who are hospitalized inpatients at Spectrum Health Lakeland, but with a positive COVID test as well. And that number has gone down significantly and is down below about 15 on average at the hospital. So that's really great news for our healthcare system. We're not in a situation where we're on the brink of potential overwhelm. Really, really encouraging. And then this graph shows the number of deaths by day. We have definitely had a decrease in our number of deaths, exactly as you would expect to see as the number of cases is decreasing. So again, we continue to be encouraged by this data. That doesn't mean that everything is just over, though. And as I mentioned, there is some potential and some opportunity depending on what's going on with variants that are a little bit more transmissible. And throughout the course of this, we have learned that the epi curve, it does kind of undulate. It goes up and it goes down, and there's some of that variation. But right now, we're pleased with the trends that we're seeing. Depending on the timing of things, and as herd immunity is increasing, those undulations will definitely be smaller. And we hope that continues to be the path that we're on. The other thing to just note too is that testing is still available throughout our community. There are still numerous testing locations. They can be found on our website, but our test turnaround time is good. We're nowhere near like the 7-day waiting periods that there were at times where we were kind of at that peak. So I want to pivot and just show you, I don't believe we've talked about this in a lot of depth at our last board meeting, but just to give you an idea of what some of our areas of focus are as a department. As you can imagine, a lot of what we're going through and doing right now, we've got COVID case investigation and contact tracing is ongoing. That was a whole other body of work that was put on us. Now we've got the vaccination, which is a whole other body of work that really requires a lot of time and effort. There's a lot of other things going on. So just to give you an idea of, as a department, how we're kind of compartmentalizing and segmenting this work, we're really thinking of it in terms of these 6 buckets that we managed to make all start with C. So we've got some alliteration there, but we've definitely got our COVID-19 vaccination. That is probably where the most hours and dollars are going in terms of effort right now. It's not the only thing that we're doing, but within vaccination, we're vaccinating people, but we're also working through partnerships. We know more and more vaccine providers are coming on board, more and more community partners are needed to make vaccination a success in our county. And we're also playing that role of chief health strategist of setting vaccination priorities and goals for our county and our community. Throughout some of the pandemic response, there's been a little bit of a void of clearly articulated goals from some of the levels of government above us. But we are making sure that here locally, we have clear goals. We're also, as I said, continuing to do case investigation and contact tracing and making sure we're doing those in meaningful ways. And part of that does include supporting school operations to make sure that we've got the right people in and out and handling quarantine. We've got a lot going with customer service in very broad terms, lots of communication, doing our hotline, scheduling information for vaccination. But then there's also just some of the core response planning. This continues to be a ever evolving situation. There's shifts in eligibility that we know are coming. There's different strategies and types of vaccination clinics that are out there, and that strategy evolves. And there's also just doing all the data management. And as public health, one of our core roles is to convene partners. And again, this is sort of rallying around those goals and priorities we've set for the county, but then how do we convene all the partners so we're all driving in that same direction? And then we also have some continuity of operations. We do have some programs that are continuing. Everything is in some sort of reduced or altered capacity, as much of the world has been for the last year. But there still are there's really important services that are continuing to happen. There are really important services that are also not happening, or not to the extent that we wish they were, but resources are finite. And then we also are doing some of this outbreak support, some of our vulnerable facilities, making sure that we're there for testing and contact tracing and doing some of that in our more vulnerable populations. So not all of these buckets is getting equal time and attention and financial resources, but this is how we're thinking through our work. So I wanted to make sure you had that bigger picture there. Now, I mean, vaccination rollout, I think this is where most folks have the most interest right now. But just to articulate once again, our goals in our community, we have developed these locally, but they are in line with everything we're hearing around us. But we want to prevent the healthcare system from being overwhelmed by COVID-19 patient care. We want to protect the most vulnerable from death and severe morbidity. And we want to maintain certain essential infrastructure. And that certain essential is really based on what the state health department is determining eligibility groups wise for essential workers, which is based on the ACIP recommendations for the prioritization of the vaccine. So there's definitely a lot of dialogue in our community about what is essential and where people fit in that priority groupings. So those are our goals and what we're working through. MDHHS does have a bit of a strategy that they have come out with, and they have some guiding principles in those strategies. So I wanted to share with you just what some of those guiding principles were. We are definitely aligned with these guiding principles, but I think that these principles help to make sure that we are doing vaccine rollout in a way that also helps with equity. So the 5 principles, and I mean, I'm not necessarily going to sit here and read them to you, but we want to make sure there's equitable access to vaccines for everybody. We want to make sure that to that end, vaccine planning and distribution, it's an inclusive process, and that local leaders and expertise from the communities we wish to target have a bit of a role in an input in how that's rolling out. That there's frequent communications that are transparent, accurate as part of trust building, and that data is really used to promote equity and guide decision making. And then lastly, just really good resource stewardship, being efficient and making sure that we're using quality improvement. So all of these things are definitely alive in how we are approaching our vaccine rollout, but these are the guiding principles that MDHHS has put out that they're trying to rally all vaccine providers around. So I want to dive a little bit deeper into what equity has looked like and how we have tried to make our strategy equitable here in Berrien County. And there's lots of different things that are overlapping with one another and related and hard to say are just distinct things. But we've kind of got some key pillars and key things that we're really maintaining top of mind. So one of them is a portfolio of clinics. I'm using this to kind of describe the different types of vaccination clinics, the different types of flows and locations and registration strategies associated with different clinic types throughout our county. We know that there are a lot of people who are more than happy to click on a link to get on a wait list, to get an email, to click on another link to register for an appointment and never talk to a soul while they're doing it. And that there's a lot of efficiencies for us in that whole process because it's somewhat automatic. We can reach, large numbers of people with relatively small few keystrokes on our end. However, we know that doesn't work for everybody. And there are people who need phone calls, whether phone calls made to them or phone calls in to us or whoever they would like to make their appointment with to learn more information. We know there are some people that have a hard time with mobility and may not be able to get out of a vehicle. So we're doing drive-through and car-side vaccination in those instances. We are also trying to be in a wide variety of geographies. We're trying to be in both locations that can handle large volumes and are mostly selected based on the capacity of the venue. But we're also looking for smaller places that are in close proximity to the people that are being targeted for vaccination and are trusted by people. So there's that. I'll go into a little bit more detail in a couple of slides of what exactly that looks like, but we're trying to make sure that there is an option that meets people where they're at so that we can maximize vaccine uptake. We also have on here what I've kind of dubbed our 70-30 principle. We are really working to make sure that 70% of our appointments and vaccination administration can go through that slightly more automated process that works for maybe a majority of our population to go internet-based and do all of that online registration. And that takes less effort for us, but we want to make sure that we have at least 30% of our vaccine administration that caters to people for whom that process just doesn't work. It's not always 70-30 as a split, and it depends on the week and it depends on what's going on, but in sum total, that's what we're going for. And some of that is because we have to balance a couple different competing needs and expectations on us. There is a huge push to make sure we're getting vaccines in arms, 90% of it within 7 days of receipt. And that is really challenging to do in only a series of a few smaller things. We do need large scale clinics to make sure we're getting through that volume, to one, be moving through our wait list, and two, make sure we're getting vaccine out. But we also want to make sure that that's not happening. That race to get vaccine into arms is not happening at the expense of excluding others that really need to be vaccinated or making it harder for them to access. So as a staff, that's how we've been thinking through this. And honestly, it's probably reversed in the amount of effort. So probably 70% of our effort is going into those 30% of appointments, and 30% of our effort is probably going into the 70, just because that's how it works. And to build on that, I mean, another key pillar here is trust and relationships. Jillian frequently says and reminds us that public health moves at the speed of trust. And trust moves at different speeds in different communities and in different settings, and all of that. So we're really trying to be in tune with our community, and where there's more need to try to build trust and demonstrate trustworthiness, and where there's relationship building, and how there can be bridges of relationships between trusted community partners and those who have the vaccine to administer. So this really takes a significant amount of time, but it's probably our best investment, not only for COVID-19 response and vaccine administration, but that's going to continue to pay dividends in our public health work for decades to come. So we are paying a lot of attention to that. We are also working very closely with Spectrum Health Lakeland and their population health team on this trust and relationships piece. We are both viewing the importance of that kind of at a similar scale. And when we're working together as a bigger team in this, we have more bandwidth and we can leverage more resources and relationships in that. So that's definitely something that is helping to ensure equity. And then really as a health department, we're trying to stay focused on that chief health strategist role. You may recall, it's probably been a couple of years since we've talked about Public Health 3.0, but it's kind of the direction the field is going. Local health departments have this role to play, that chief health strategist. And it's not just directing and having a strategic plan for our organization, but having that broader plan for a community. So the fact that we're setting goals, we're making sure we're regularly connecting with partners and staying in touch with what other vaccine providers are doing. We are having a community-based order in which we're working through the priority groups and eligibility groups. We're doing all of those things. At the same time, because we have that line of sight and we have those partnerships, we can also play our assurance role, because assurance is one of the core functions of public health. We don't have to do all of the things. We just need to make sure all the things are done. So when we've got other vaccine providers that are getting vaccine out to the right groups, we're thrilled because we want people to be vaccinated. It doesn't have to be by us. Working with Spectrum Health Lakeland Pop Health team, when they're doing some community-based things or some planning and some, they've been doing a lot of community dialogue about vaccine hesitancy. That's fantastic. We wish we could be more in that direct work, but we are assuring that it's happening and we get to have a say in some of the planning of how that's done. So really living into those roles, we don't have time to try to do all the things. And then again, with that focus within priority groups, The eligibility groups are really big and represent tens of thousands of people in our county. And so there has to be a bit of an order of how we work through them to make sure that we're not diluting our efforts towards those 3 vaccination goals that we have. So those are a lot of the ways we're thinking about equity in incorporating our strategy into our strategy. What I want to share with you here, these are some snapshots from the COVID-19 vaccine dashboard that the state has on their website. It's found at michigan.gov/COVID vaccine. But there's lots of different tabs, across the top. So there's lots of different graphics that you can see here. You can look at the whole state, or you can look at an individual county. You cannot subdivide by different providers within a county, but there's lots of great information here. If you haven't explored it, I'd recommend, if you've got 10, 15 minutes to spare, to go check it out. This is showing us doses administered by any provider, anybody who has vaccine, to residents of Berrien County. So even Berrien County residents who have gone somewhere else for a vaccine, if they've received it in another county, they're showing up here. This is by county of residence. But you can see that as of March 1st, Berrien County residents have received 37,732 doses of vaccine. Now that's doses. There are a lot of second doses in here, but the state offers this nice little scale of color coding, and you can see Berrien County, we're in the high area. We are ranking near the top of just per capita how many doses have gotten out. So I think we're doing a fantastic job as the health department, as well as our partners, of really getting vaccine out there. We have not been sitting on vaccine. Our health system has not been sitting on vaccine. We are getting it into arms. Now, this next slide is showing within that dashboard, you can also look at vaccination coverage. And this is where it will tell you individually how many people have initiated vaccination. And that's what this top one is here. It's initiation. We have 24,919 people as of Monday that had received at least 1 dose of vaccine, or had received 1. So we also, here in the back, when we look at completion, there are 12,800 that are complete. They've already received the 2nd dose. So the fact that we're moving through this, the percentages that are listed here, the denominator is all people in the county 16 years and older. It's a little bit misleading because we've actually gotten fairly good coverage. There's thousands more to do, but we've gotten fairly good coverage of our older adults 65 plus. We don't have necessarily a good percentage on that. But when we look at the number of people in Berrien County who are 16 or older, and that's based on who is technically eligible to receive any vaccine that's on the market right now, that's 20% have received at least 1. That's pretty good for being 2 months out from this, from the start.
Real good.
Yes, doing great in our county. So I'm going to go to the next slide and then maybe come back to this. So just to show you some of the data and how those numbers shake out by provider. And we're not able to get super detailed information on other providers. That's why you see we've got all 4 boxes here for the health department, and then it gets leaner as we get down. But the health department, as of the end of the day yesterday, we had administered 17,536 doses of vaccine. Over 12,000 of those have gone to adults 65 plus. And then there's a breakdown of about 12,700 are first doses and 4,700 are second doses. So that's a lot. That's a lot of vaccine that has been administered by our staff. We're very proud of the effort that they have done, but again, we're not through this, and it's ongoing. Spectrum Health Lakeland has administered about 12,000 doses of the vaccine. They have not been receiving as much in their allocations over the last month or so, so their pace has slowed a little bit. There has been a little bit more of a shift towards the state providing more vaccine to local health departments compared to health systems, but they have absolutely stayed up in there. And we know that 7,000 of their doses of vaccine have gone to adults 65 plus. The vast majority of everything else that they've given has gone to healthcare providers. So that's good. And then we have about 8,000 other doses that have been given by other providers. We do have a Meyer, the Meyer in Benton Harbor that is providing vaccine. This also includes the federal contracts for long-term care facilities. So our long-term care facility residents and staff would be included in this number. And there's a handful of other pharmacies that have received some smaller quantities of vaccine and have started administering in Berrien County as well. This graph below just shows you a bit of a timeline of vaccine that has been administered. It does not distinguish between first dose, second dose. This is just vaccination administered, but by day you can see how many doses of vaccine we've given. The darker bars have been given at a clinic here at our health department office, and the green bars are those out in the community. So you can see we are definitely moving towards getting a lot more vaccine in these community-based settings. And then I'm going to go back to this slide just to talk about our portfolio of clinics. I referred to this before, but just to go into a little bit more detail, we kind of have these 4 types of vaccine clinics. There's a little bit of variation within them, but we have the large scale clinics. Some of you, I think, have been through some of our large scale clinics, and these have had a bit more coverage in the media. But this is where we're seeing, I mean, I think our max that we've seen at a clinic is like 1,360 people in one day. But we've done large scale clinics for healthcare workers, essential workers, and adults 65 plus, basically everybody who's eligible at this point. That's one way we're tackling those groups, is through these large scale clinics. We've also done drive-through clinics. We've had excellent partnerships and been hosted very graciously by numerous fire departments across our county, and so that we would be able to have a drive-through for vaccination while still having our staff in a little bit sheltered of an environment. And it's easier to keep the vaccine at the right temperature when we have a little bit of shelter, especially as cold as January and February had been. But targeting some of the same groups there, just in various locales throughout the county. Then we also have what we've been calling pop-up clinics. And this is really where we're going to other locations. We've been in churches, we've done a lot with our senior centers, we've gone to some senior apartments, subsidized senior apartments, a lot of different places that are more neighborhood based. And the hosts do a lot of work to help do outreach to make sure we're getting the right people into those clinics. So we're going to continue to increase the amount of pop-up clinics we have as we get more vaccine providers online that are administering vaccine. Our unique role in our agility as the health department to be able to take our operation on the road and go to these these community-based sites is really valuable for our community. And we need to make sure we're leaning into that, because there is not another vaccine provider that can operate those things in the same way that we can. And we've also done some on-site in different types of congregate care facilities, nursing homes, adult foster care, and those sorts of things. So these are sort of our menu of options of how we could approach vaccination as the eligibility groups continue to evolve and open up. How we're leaning into different parts of this portfolio will shift over time, as you could imagine. Okay, I'm going to actually turn it over to Jillian for a moment to just talk with us a little bit about communications and outreach. We know that communication and information sharing has really been a huge piece of this pandemic response, and there's been a lot going on in that world. So Jillian, take it away.
Yes, thank you, Nikki. So I mean, I think all of you can really appreciate just the challenges that we've had with the logistics and the operations with rollout of vaccine. And then there are the communication challenges and just the context that we're working within. Obviously, we know that vaccines are being rolled out in multiple different phases with different people eligible at different times, making sure that that is very clear and that we can get as granular as possible, especially when it comes to those workers. Those essentially has been a big part of a lot of the communication that we are doing. In addition to the fact that we have a lot of diverse audiences. At this moment in time, we've been doing vaccines, as you've seen, for our older adults over the age of 65 that may have some just different ways of wanting to receive information than some of those frontline workers who we might be able to reach through employers, for instance. So the diversity of audiences that we are trying to reach certainly adds a layer of complexity to the different modalities that we have to use when communicating. And then, of course, there's been the ever-flowing shifts in demand and supply. I should say demand hasn't really shifted. We've had a lot of demand, but the shifts in supply and just that message that is very difficult for a lot of folks to know that they're on a waiting list of potentially tens of thousands of people waiting for a vaccine that they very much want. And of course, all of our strategy is nestled within what the state's communication strategy is as well. We are in frequent communication with our state partners at MDHHS, understanding what's up next as far as communication tactics and where they're going with some of their paid advertising and campaign. So we are always attempting to share what they're doing and really align our messages with the state as well as with our partners in other county health departments across the state. I think that that's been to the benefit of all of us when we are well aligned and health departments are saying the same things. So like Nikki was saying earlier, you know, we definitely kind of have this 70-30 sort of approach. And when it comes to mass communication, we know that that will work for a number of people within our population. We've got a very healthy following on our social media pages, namely Facebook and Instagram at this point. And folks follow us there, they engage with our posts, they see, they share, and that's a great way for a lot of people to receive information. In January, well, I think actually back in December, we started a new newsletter, a community newsletter that was geared towards providing information about COVID-19 vaccines. And we stuck in other information into that newsletter as well. But that has been a really popular newsletter that people have been signing up for. We have been able to get out a newsletter weekly over the past 2+ months, which I'm really proud of, that we're able to keep turning out that content and just sharing what is the latest, where are we at. Very similar as to you got an update today from Nikki, we're providing that same sort of update for our community members through that newsletter. And we're often sharing some of our social media content that might have been put out throughout the week, especially those really valuable Facebook Live videos, our kind of community and media briefings, if you will, that have been happening tandemly with Spectrum Health Lakeland. Over the past year, really, we've been almost at it for a year, but Nikki and Dr. Lauren Hamill from Spectrum Health Lakeland do a great job with providing those updates. And so we're sharing those out in a variety of ways. And then we obviously use our media partners when they're looking to do interviews and if they've got story ideas. So earned media has been really important. I think on average, we've been doing probably at least 5 to 7 interviews every week across radio, television, newspaper. So we are getting out there. There are a lot of interview requests, and we do as many of them as we possibly can to make sure that we're taking all of those opportunities to have our media partners help us spread the word. And then, we are also really trying to balance that mass communication strategy with targeting our harder to reach populations. These individuals may not be following us on Facebook or reading the newsletter through email if they're not big internet users, and getting information out to all of our residents, really making sure we're using the communication tactics that work best for them. A big part of this has been through partnership with Spectrum Health Lakeland's population health team, as Nikki had alluded to. They have been integral in really helping to reach into our community deeper and deeper. And a lot of that has been in those word of mouth influence, community dialogue opportunities. I think you've probably heard over the last several months about a community influencer group that we at the health department kind of share leadership with Lakeland's population health team. These are individuals we have in the Benton Harbor and Benton Heights area, as well as in the Niles area, who are willing to serve as information ambassadors within their own sphere of influence. We meet regularly with them, provide them with information about what's going on, what's the latest, what are the things that communities need to know, their community members need to know, and then they sort of go forth into the world and share that news in their own spheres. So whether it's with they're following on social media or with a sorority group that they're part of, with the people that they are working with in their professional capacity. There's a lot of different people that we have as part of those groups who have been really wonderful influencers in getting information out and sharing those messages even deeper into the community. And a lot of this does rely on just lower tech options. So we're not as heavy in social media, and we might be using hard copy printed flyers, getting things into church bulletins, doing direct door mailers, posting up flyers around town. We've used a lot of those methods throughout the pandemic, and we'll continue to put efforts into some of those lower tech options to make sure that we really are reaching all of our audiences in the ways that make the most sense to them in receiving information. So that's kind of, just where we're at in a nutshell. Obviously, there's always more that we can be doing with communication. I never feel like my job is done, our job is finished or complete with that. So we are always open to new ways, new creative ways to get information out, especially as we're hearing feedback from our community members about how they'd like to receive information and kind of where they're looking for that. But we are really proud of the work that we've done and proud of the reputation that we've built as a trusted source of information, that people are really looking to us for the latest on vaccine rollout. And we are here to serve and here to provide that information, especially when it comes to vaccination. We want people to have all of it available to them in a way that makes sense to them, breaking down some of the science jargon, especially about vaccination, and be transparent with all of the data, all of the information that we have, so that folks can make informed decisions about whether they should be receiving the vaccine for themselves. And if they want that for themselves or for their loved ones, that's really important to us. So Nikki, I don't know if there's anything you'd want to add to that.
Nope. I mean, I think you've covered that pretty well. We've got a few more slides. I'm going to keep us moving along. That way we can get to questions and some discussion there too. Something else that you may have heard about, and there's been a lot of talk out of the state, is the Social Vulnerability Index. And that has been one of the things kind of that we've been thinking about throughout, and this is a piece of that equitable strategy. But the Social Vulnerability Index, or the SVI, is actually something that comes from the CDC, and it's an index. It takes a lot of different data points together and creates a measure of how socially vulnerable a community is. So it really helps to identify communities that, as the state is putting it, might have more difficulty preventing human suffering and financial loss in a disaster. And understanding where that vulnerability is helps to target resources. So there's a variety of data points that you can see kind of outlined here regarding socioeconomic status, family composition and disability, minority status and language spoken at home, as well as housing type and transportation. All of those things kind of come together to form the SVI, which is a numerical number assigned to different census tracts throughout the country, so that there's better understanding of, again, where there might be some of those increased risk of adverse outcomes. And that is really intended to help with the distribution of scarce resources in COVID-19. That is in things like testing and vaccination. And the state is really is pushing on this. There has been some opportunity for to tell the state how you are planning to target SVIs and to get a little bit of a boost in a one-time boost with several hundred to maybe a couple thousand doses of vaccine to really target those areas. But I think these are going to be some of the metrics I alluded to earlier, that there's this metric of you have to get 90% of the doses of vaccine administered within 7 days of receipt. And that's part of how success is being measured. We had kind of spoken up about that doesn't help take equity into account. So monitoring how coverage is going in high SVI areas is another way to maybe monitor how vaccine is rolling out and if it's truly getting into all of the right arms or if it's just getting out quickly. So in case you've been hearing about that, wanted you to have some context of what the SVI was. Now, we've got a lot of forward planning that we're continuing to do. As you imagine, this first group of eligibility, or I guess first and second group of eligibility we're in right now. There's many more to come. Agricultural workers, and there's a more narrow definition. It's really about agricultural food manufacturing. Those workers are eligible per the state beginning March 1. So there are plans in place for that, and Intercare will definitely be a major partner in that effort. The state has also indicated that adults 60 plus in those census tracts with the high SVI could have some additional eligibility. And then we know that we're moving into adults under the age of 65 with underlying health conditions. Those underlying health conditions have not really been clearly defined, so that there's clarity as to what is meant by that. But there's more eligibility groups coming. There's more groups of essential workers, and there's going to be more. So we're definitely planning for that. But we're continuing to really settle into our marathon pace. The staff is hearing me say this, last week I was talking about how we were in mile 5 of this marathon. We're probably solidly in mile 6 right now. Still a lot to go, but we're settling into that, making sure that we're defining roles with all of our partners and really remaining committed to focusing on equity. And as you may imagine, some of the challenges, staff time just is finite, and there's a lot of work to do. So there's lots happening. And as the landscape keeps changing and evolving, that also requires a significant amount of time and effort for coordination, planning, the one-on-one interactions with our community members who have questions on our hotline, like that's just growing in complexity and time needed. So that's certainly something we're continuing to work through. We've had volunteers that have come that have helped bolster some of our support and our bandwidth at our clinics. We are so grateful. I continue to be amazed and inspired by people who are willing to spend 8 to 10 hours in our parking lot on very, very cold days and find joy and meaning in that work. So we're very grateful for our volunteers. Other challenges, there's just vaccine hesitancy out there. While the vaccine is in scarce resource, we're seeing that demand to supply is very high. There's going to come a point where those kind of the inflection point where it starts to tip the other way. And we're planning for that, but also trying to address it right now. We don't want people who are eligible to wait just because they're not sure. So again, going back to we are trying to have trust and authentic relationships, that does require time and effort. We're doing it, but it's challenging. And there's just lots of information and data from lots of different places that we want them all to meet each other very neatly. We don't have necessarily the tools. I don't think anybody has the tools to really make that happen most efficiently, but we're working through that. And then we're also just really being mindful of all of the things we're not doing as a public health department. There are mounting needs in that area because some of the very services that we can't provide in full are needed even more now due to all of the collateral damage of COVID-19 response. So we're mindful of that. But something that has really helped to break up the logjam with supply and some other issues is really the release of the Johnson & Johnson vaccine. So I don't know, Dr. J, if you want to talk a little bit about the Johnson & Johnson vaccine, make sure we all have the same overview.
I'd be glad to. And if I might first just read, just it goes with some of the stuff that's been said before. This was a text I received late last night from a businessman who's now retired, who many of you may know. As time goes by, I hear all the confusion and yapping on mainstream media. I give thanks for the wonderful crew at the Berrien County Health Department. You have all nailed it by prioritizing the most needy and vulnerable. I give thanks to all who are working so hard. And in bold print, everybody speaks so highly of the Berrien County Health Department efforts and their honest vaccination process. I thank our Lord and to all who have been so diligent. You all are the best. Keep on trucking. And I won't say his name because I know, but that's just one of many things we heard. That was from a person that several of you would know. And so I just think that's great. And we did intentionally from the very beginning try to do the most vulnerable and prioritize the elderly. And just to support that, there's been multiple data that supported that was the wise thing from the beginning on through. But a couple of days ago, there was some new data that came out from the CDC on the infection fatality rate. And just to show how important it is to look at ages, from 0, so the infection fatality rate is for the number of people infected, how many end up dying, okay? which indirectly is a measure of how many people get seriously ill. From 0 to 19 years of age, the infection fatality rate is 0.003%. That's 3 per 100,000 cases. And if you look at these, the majority of those cases, and every group that I'm going to go through, are people with significant comorbidities. So keep that in mind too. From 20 to 49, it's 0.02%. That's 2 per 10,000. From 50 to 69, it's 0.5%, 5 per 1,000. But then if you go to 70 and beyond, it's 5.4%. That's more than 5 for every 100 people who get the disease. So if anybody has any doubt that the importance of prioritizing by age here was a very worthwhile, focus in the beginning, that data should clearly show, and there's been other data showing that before, but that to me is like the clearest statement yet, based on a huge volume of data, and this is from the CDC. So I'd just like to, point that out. And by the way, the 4 comorbidities, there have been several recent studies that are like mega studies that have looked at the biggest risk factors. What are the biggest risk factors? Number 1, obesity. And this now goes down to the people in some of those younger age groups, the 20 through 69-year-olds. So obesity, being a type 2 diabetic, having heart disease, or being hypertensive. So those are the big 4 in terms of the the comorbidities. So I just like to say a word about Johnson & Johnson vaccine, because the mainstream media keeps putting out all kinds of different opinions about it, statements, and the headlines can be very misleading at times. But the Johnson & Johnson vaccine has got several wonderful benefits, one of which is it's 1 dose. The second thing is that it can be refrigerated very easily. It can be stored in a regular refrigerator for 3 months. Compare that to Moderna and Pfizer, there's no comparison. And the side effect profile of it is definitely much less. So there are many less cases of fever. It's way below 10%. And there's been no cases of anaphylaxis with it. It's delivered with in a viral particle, a virus that can't propagate in you, an adenovirus, instead of a little lipid envelope, which is reactogenic and has made a lot of people with Pfizer and Moderna have reactions. So it's a different deal. So the side effects are definitely less. So that's really good. There have been no known cases of anaphylaxis from this yet. And they had the most robust study. There were more than 44,000 participants in the study. And by the way, no one who got the vaccine in the trials died from COVID, which is pretty good. So if you actually really look at you can't compare this to the other vaccines like is tried to be done in terms of the serious side effects and the worst outcomes, because it's not a head-to-head comparison. And how serious illness endpoints are measured is very, very different. Not to mention that this vaccine was tried beside the United States, several other countries, including Brazil and South Africa. So there is a little bit of a variant factor in terms of how effective it is in preventing moderate disease. But it's certainly at least 86% effective in preventing serious illness and death. And that's especially what we particularly want. So the other thing is it also offers quicker protection. At 14 days, the protection that can be measured and offered by this vaccine is actually a little bit better. So when people say we're going to be giving it, some people say, and some media things sort of intimate or say directly that we'll be giving a second-rate vaccine to some people, that is not true. It's a really good vaccine, and it's only 1 dose. So that's something that we'll be rolling out more and more, and we'll be getting ours shortly, if not today. Nick, you might know more about that than me at this moment. So that's the sort of the skinny on the COVID vaccine. And also, they're promising for the United States 100 million doses by July 1st, which is obviously a significant game changer. And I hope that answers some basic questions about it.
I didn't catch, Dr. J, which, when you went through the morbidity numbers, what was your source?
This is the CDC.
Oh, okay, great,
Data.
thanks.
And this wasn't morbidity, this is mortality numbers.
Mortality, sorry.
Right.
All right, thank you for that
Sure.
clarification.
So, I mean, that's what we have for you all. I'm happy to entertain questions or discussion or anything. I know we gave you a lot of information.
I have a comment. I went off mute, but being down here in Florida and in a very large population area county, and looking at sometimes when you can look outside your own venue, you see what a magnificent job you people have done. Because when I compare what is going on here, it's chaos. People, you talk to them, it's very confusing. They haven't even scratched the surface of what you've done. And I know it's a much larger population, but they also have then greater resources. And you can't even, I mean, it's night and day. It's unbelievable. So I, again, applause and hats off to you guys. I do have a couple of quick questions. One is, what kind of wait list or backlog do we have, if any? And there will be like a vaccine surge that you talked about. We're going to have maybe have more vaccine of it. Yeah, but you're also the demand as you go under the 65 is going to be great. So it will be taxing you more. And I don't know how you coordinate all that with the drugstores and Meyer and the hospital and yourselves. That's got to be a big task. I'm sure you'll do fine, but I'm just curious how that's being planned. And I'm going to go on mute again.
Yeah.
Hey, Joe, can I just want to, you and I have been emailing back and forth about this issue and what's going on down in Florida. And my dental hygienist the other day related to her parents who grew up in this area and are down in Florida now. They were in Orlando's county, and they're like many of the counties, and their percentage of the population that have been vaccinated is no better than ours, and then some places worse, as you mentioned. But they got online at 4:00 in the morning, and there were people there from 11 p.m. that night on many of the clinics that are there. And they got there at 4 a.m. and weren't vaccinated until 10:30 in the morning. And there were people who waited longer, and you weren't even guaranteed that you might get it. So yes, thanks. You're right.
I was in a lottery. I did get I got on a list, and I did get my Moderna, and I'm scheduled. Once I actually got there, they were pretty efficient in administering the dosage. They did 3,000 in the day, and I wasn't there half an hour, so it was fine. But it's the whole registration process and what you people are doing to outreach. They do nothing. So it's it's so well thought out that you guys. I'm really impressed by what you've done all this time.
Well, thank you. So to get at your question about the wait list, it's not as straightforward of an answer. We do still have thousands of people on our wait list. I think we're under 10,000. However, as we've made phone calls to people to get them registered, we are finding that there are lots of people, a significant percentage are saying, I've already been vaccinated somewhere else. So it's hard to say how many of those people on our wait list are actually still waiting, but we're continuing to move through that. And with some of the increases in allocation of both the Moderna that's becoming available, as well as now Johnson & Johnson, we're not getting Pfizer any longer in our county, or at least we haven't been. But with the increases in vaccination, we are looking to hold larger clinics so that our large scale clinics are larger. There's some efficiencies to be gained in similar amounts of effort and getting more people through. So that's one of the ways that we'll be able to handle that. But yes, you're right. It is a big challenge. But I'm pretty hopeful that in the next couple of weeks, with a couple of those larger scale clinics that we'll be doing, and some of them in conjunction with Spectrum Health Lakeland, our wait list will be really, really low.
I saw Ken had a comment or question.
Yeah, a couple of questions, actually. One, first of all, let me echo the compliments. The feedback that I've gotten, my entire office was vaccinated at the health department, nothing but praise, and every patient that I've had and referred there has just echoed the praise that we've heard. I do have two questions. One is, what is the plan to inoculate the migrant population when they start coming to Berrien County? And the second is, when once you open the floodgates beyond 65, there's going to be a real uptick in demand. And have you thought of a program to solicit volunteer nurses, physicians, things of that nature to help supplement what is becoming tremendously overworked people? I look at Candy and I'm amazed she can sit up. She must be exhausted at this time. But just curious about those two things, migrants and volunteers.
Yeah, and Courtney, please jump in because you have been really leading with Intercare, but Intercare will be taking the lead. They do take the lead on a lot of things related to migrant health, similar with the testing protocols that were in place last season, last year as well. So a lot of planning is underway with Intercare for that. We know that the migrants Intercare cover are not all of the food manufacturing workers that are eligible for vaccination, but Intercare will be a key partner in that. Courtney, what would you add?
I think that that's kind of a good summary of where we are right now. But if you'll remember, we did have kind of a model of partnership with Intercare last summer where they had their field teams and used their migrant health kind of mobile unit and teams to be out on the farm. So at this point, it's really kind of back to that point of building those relationships and touch points with our growers. It's still early season for us, which is good. We're trying to get ahead of that. A lot of those efforts are going to have to be around education and vaccine confidence. There's also just a lot of our migrant workers we get a lot of the H2A workers, which I can't give you all of the nuance of the different certifications, but H2A workers, which tend to be younger single males who come for migrant workers. And so there's just a lot of hesitancy there of I'm young and healthy. And so how do we support them in having the right information and in a timely manner to then be vaccinated? So I know that Intercare is really working on that. We already have a work group along with the Michigan Department of Health and Human Services Migrant Affairs to have a really good structure that when our workers start arriving, we're not playing catch up, but we're in advance of their arrival.
Yep.
I would just comment on the volunteers. When we went to get our vaccination shot, Ken, my wife being a retired nurse, they were actually soliciting at the vaccination site for volunteers because those people, of course, once they're inoculated, they have a comfort level of volunteering because they're volunteering, for people are coming in who are not vaccinated. So they actually gave her an application at the time of getting her shot to determine, whether she may well do it. But they did a very proactive. That's one good thing they did do it.
Yeah. And we do have, we've received a small handful of people who have been interested in becoming volunteer vaccinators, and we're working through a vetting process right now because that's just a little bit newer for us. We are continuing to really depend on having the National Guard to expand our capacity and bandwidth as well. So we do have medics from the National Guard helping at most of our large scale clinics.
I saw Dr. McBride and then I saw Ray. So
Couple of things. We got our vaccine, my wife and I, on Monday. Incredibly quick, incredibly efficient, incredibly courteous. My question is, looking at some social media sites and news sites, I'm seeing questions raised about Johnson & Johnson on the cell lines used to develop the vaccine. So I'm seeing some opposition to it. Can you say anything about that, Dr. J?
Sure. Well, I haven't seen the exact latest stuff. That was also raised in the other vaccines, the mRNA vaccines. So as you know, the Vatican and the Pope and others have gotten it. I haven't seen anything directly from the U.S. bishops of the Catholic Church opposed to the Johnson & Johnson at all. In the original, not in the studies that have looked at all these vaccines, a cell line that was from aborted fetal tissue from the 1950s or 60s from the lung tissue. Almost all cell tissue cultures dissipate quickly and are unusable. For some reason or other, this one cell line from this one aborted fetus, this lung tissue, has just perpetuated forever and has been used in research on lots of products. And the Vatican has long ago signed off on that. There's a couple of other vaccines, a particular measles vaccine that was used that way. And it's determined it's okay to do it. I haven't seen anything beyond that, although I saw a little message from Ken, and I will certainly look into see if there's something new and different. But
Yeah.
that's everything I've read about it so far.
It's just, I think, has to be dealt with transparency. I think you're going to hear some of these things, but
Sure.
the bishop did a pronouncement yesterday.
For sure. And if there is something a little different about Johnson & Johnson, then people that feel that way then could jump to the other one for sure.
Right.
But I haven't seen anything exactly proven.
It's something we need to be aware of. But listen, I'm so proud of our health department. My colleagues in Miami who are retired, they waited in line 3 hours for a shot.
Yeah, exactly.
And I waited in line 5 minutes on Monday. So just congratulations on efficiency.
Ray, you want to unmute?
Thanks, Peg. Two comments. One is I did have the opportunity to take my wife up to the health department for her vaccine, and I was extremely impressed with the efficiency. We were, down to the minute. The people there were just fantastic. Waiting time was really short. Good efficiency in keeping you there 15 minutes, moving you in and out. Nothing but praise the whole way around. I expected a long wait just to get to the front door, and I was pleasantly shocked. The other thing is I'm kind of struggling some of the things that everybody else is saying about these wait times. I'm trying to, from afar, find vaccines for mother-in-laws and aunts in Pennsylvania, and you wouldn't believe how bad it is in some particular counties there. They're like big counties outside of Pittsburgh that are 500,000 people population, and they're the worst in the state there. So there's we're pretty darn lucky. Good job.
I think
Thanks,
some places do
Thank
some
you.
really strange prioritization. You're right.
It's just incredible. The people getting up at 4 o'clock in the morning to get on the internet, waiting for an hour to find out that there's no vaccines available when they could have told you that right up front. It's just maddening.
And
Dr. Harris? Go ahead.
Well, I was
Nikki,
just going to
sorry.
say, we'd be remiss to say that, Courtney has done a lot and led a lot of the planning of just how the actual clinics operate. And she has been very thoughtful and mindful of our consumer experience. So very pleased with her efforts and proud of that. And glad to hear that people are continuing to have really good experiences, because we tried to design it that way. So thank you.
I hope to get on the volunteer list. I think it seems to be very rewarding. So keep watching as they come out, and they seem to fill up quickly, which is good. A lot of people in the community want to participate.
Good. Dr. Harrison, I see your hand is up.
Yeah, I guess I know when you're in the midst of this, you kind of don't want to think ahead, but thinking about the potential for a booster shot in the fall, are there some infrastructure changes we'd like to make or think would help smooth the process even more? I think specifically, the registry as well as the phone system, because it might be time to look at those changes we think would help improve the process and get that in the pipeline now, especially assuming there'll be some more cash coming out of the feds and some more investment potential and things like that. Not just for, the pandemic, but down the road, if indeed we get stuck in a situation like this, in the next couple of years.
Yeah, thank you for that. We are trying to do some of that thinking ahead, but absolutely appreciate the questions with that. In terms of, I think you hit it on the head that the phones and the people to answer the phones are probably going to be the biggest limiting thing if it becomes a new development. In terms of the state registry and what we have in place for tracking who's been vaccinated and who has received what vaccine when, we do have all of that. And so while it would definitely take a bit of maneuvering, I think we could add in a workflow for administration of a third vaccine. Oh, that sounds painful to even say out loud. So we hope that it doesn't come to that for many reasons, mostly for the health of our community, but then difficulty in responding. But yes, the phones capacity is the thing that we need to work on the most. And we've been doing a lot of internal thinking about that and trying to identify what resources would be needed to bring things to fruition. It's been a pain point for the last 2 months.
I think I have everyone's questions. I'm looking at the time. Did I miss anybody who wanted to ask a question? All right. Anything else before we move on to item 5C, medical direction?
No, thank you.
Thank you.
So in medical direction, thanks for the opportunity to be here again, of course. I, after the opportunity and privilege to serve the Berrien County Health Department for about 44 years, I will be retiring in 3 months. I have worked with terrific people here, including those of you on the board who I really value. Thank you very much, board people. If you guys will give me the latitude for a short delve into history, I'll promise to close the loop with exhortations for the future. I'd like to just talk very shortly about people, programs, and the pandemic. This week, I'll just talk a little bit about people. In April, I'll talk about programs, and if you want me back, and in May, I'll talk about the pandemic and beyond. Of course, life events are shaped by, the people we've come in contact with. And for me, of course, that's true too. And I'd like to focus in on a few of the people in my medical past and background, a few of the health officers I've known, a few of the Board of Health members, and also the medical directors that I've worked with. So in terms of the medical past, I went to a fairly average medical school. I had always been interested in doing medical missions work and being a doctor and being able to teach back from time of my middle school years. And with God's providence and a whole host of connections that ultimately happened, that I ended up going from a relatively average medical school to a spectacular residency program, which you could argue was one of the best in the country. And it's where Ken went to medical school, actually, in Syracuse, New York. So Ken knows all about this place. The chair of the department was a guy named Frank Oski. He was, besides being a spectacular hematologist and pediatrician, he was the national director of pediatric research. He was the author of the major texts used by pediatricians around the world. He started a journal. It's the #1 pediatric journal read to this day across the country. He started that. A very serious, terrible cancer was acute lymphoblastic leukemia, which affected children. Frank devised the registry and protocols to unify other health systems to look at that and how to treat it. And during his leadership, in a short 4-year period, acute lymphoblastic leukemia went from 90% fatal to only 10% fatal with the work that he did. And he was involved in many other things. And it was a terrific mentor. My wife got to play tennis with him. He was a great guy, but he also was very interested in lead poisoning, ended up being helpful. He was very interested in public health, and he did something that no one else did at the time. We were required to go out and do home visits on some of the patients that we were most acquainted with while we were residents during our program. That was unheard of and spectacular. He later went on to be the head guy at Johns Hopkins for several decades and did incredible work there too. So, he's one just outstanding person. But also just before him, the medical director in Syracuse of the pediatric program there was a guy named Julius Richmond, who left that department to become the Surgeon General of the United States. And Julius Richmond left a great public health legacy at that program. He, among other things, in the 1960s, during the Johnson administration, he was the first national director of the Head Start program. He also was influential in starting neighborhood health centers, which became the forerunners of federally qualified health centers. And one of the first ones was in Syracuse, where I had an opportunity to work during my residency. And thirdly, he also was the author of the first behavior risk factor survey and actually put together the quantitative measures to be used in BRFSs, which we use today. So that was Julius Richmond. He left a great legacy and obviously was influential. I only met him twice, was influential in what happened to me. Most of my fellow pediatric residents in Syracuse, because of this program, had great connections, went on to become faculty members at other medical schools. They joined the CDC. They worked for the World Health Organization, other organizations. I had opportunities to do stuff like that, but I'd always been interested in doing this overseas medical mission stuff and doing some teaching. But I kept getting these ads from the Christian Medical and Dental Society about this group, the Southwestern Medical Clinic in Berrien County, Michigan, that was looking for its first full-time pediatrician. And I kept pitching these away month after month after month during my residency. Like, why would anybody want to leave the enlightened East to head to the Midwest? Little did I know how great it is out here. But finally, through a set of circumstances and some letters from Dr. Silvernail, who was the medical director here previously, and from Don Gast, a guy who was on our board of health, was a county commissioner, and for years was the administrator of Southwestern Medical Clinic. I ended up coming here. So after I arrived, within a year and a half was the chief of staff at Berrien General Hospital. I was working the migrant clinic at night because there was no Intercare or Marcha yet. And one day, Don Gast came up to me and said, "Do you like public health?" I said, "Yeah, I love public health." He says, "Well, would you go up to the health department this afternoon and just meet with some people up there and see if you're interested in filling in there when Dr. Silvernail's gone to Haiti?" And I said, "Okay." So I arrived shortly after noon, a little after I was finishing the morning clinic, and Jerry Erickson, the health officer, saw me through the window, went out into the little lobby there on Pipestone and said, "We have a team here from the CDC today looking at lead poisoning in Benton Harbor, and they're giving their first blush on their initial report. You want to sit in on it?" I said, "Sure." So I sat down in there with the CDC team. Being the type A personality I am, and you guys know, the guy making the presentation, I corrected him on one of his statements and then asked him a few questions about could we not do this and could we not do this, and made a few suggestions. So with that, the nurse from the health department came in and said, "We're ready to take you on the rest of the tour." So I left the meeting. So apparently right after I left, and I've heard this from a couple of sources, the guy from the CDC said, "I don't know who the heck he is, but you ought to hire him immediately." So 3 hours later, I got a phone call from Jerry Erickson offering me a job to fill in as the deputy medical director. This is in 1977, and the rest is history. So interesting timing of the health department, the CDC and lead poisoning. So just a word about Jerry Erickson, who was a wonderful health officer. He was the first ever non-MD health officer in the state of Michigan. Before that, they were always MDs also. He was the first one. He was very interested in health education, and he hired Mike Mortimer as his health educator. And Mike, as you know, rose to the ranks, became the head of clinical services, and then later became my second health officer. When Mike took over, he had 3 priorities, and we discussed these together. His 3 priorities was getting the commissioners to okay 3 new positions, which had never had here before. Number 1 was we needed an epidemiologist. Aha! One of the epidemiologists along the way was Nikki. And also, to continue the loop, was Guy to go to today. So that was obviously a stroke of genius in all the things that epidemiologists and the people it has brought. The second thing he said, we need a grant writer. We need to get more money from outside sources, and relying on people doing all these other jobs, doing grant writers, was almost impossibility. So we had a string of grant writers, and not the least of whom was Jillian, who has now moved on to do the spectacular work she's been doing. And we've already heard from Jillian today. Thank you, Jillian. And then the last thing was that we needed a health planner. And so Teresa Green was hired. And we all know the work that Teresa Green did in the world of both equity and in lead poisoning, and getting us, really got us the HUD $2 million lead grant. So those were some of the things that Mike did that were spectacular. Now, Nikki, she's been my 3rd health officer, and I'm going to speak more about her in the coming weeks in the interest of time. But one great thing Nikki did was hire Courtney as a deputy health officer. And I have no idea where we would be today without Courtney and the spectacular work she's done and all the things that we've talked about also. It would be beyond a one-person job. So those are the 3 health officers, and they were all pretty awesome. Now I'd like to say something about the Board of Health. So the Board of Health, we have had some spectacular chair people. So Frank Porman, of course, was very, very influential. Frank cared about the poor. He personally cared about how we at the health department service the poor. Lois Owicki did a great job. One thing that stands in mind with me for Lois is she felt really passionate and got us a mobile unit where we went out to poor schools, primarily in Benton Harbor and in Niles, and did EPSDT screening. Those units had water, heat, and electricity, and we were able to go and do some screening to some very vulnerable people. That was one of the things Lois did. And then there's this guy, Dwayne McBride, who also was a chair of the Board of Health. So you could think of many things about Dwayne, but when we first decided to embark on doing a BRFS, where there was no money, we couldn't get any money out of the county commissioners, and there was no money in the budget. And so Dwayne stepped up with his sociology department at Andrews, and they compiled the data. They prepared the report for us, in the years before we could actually get some money to do it. So that was just one of many things Dwayne has done. And then, Peg, I want to thank you for your work. Anytime you can get somebody who seems to be a natural to me, somebody who's a theologian and also involved in the environment, seems like just a natural since God created everything. So thank you. So the board has also always had a physician on the board, which I think was very, very wise. In the years when I started, it was a dermatologist from Benton Harbor, Dr. Mesereau. And then through the years, we've also had Dr. Emery, of course, who kept asking, what is public health? What is, he said that every month. And then we had Dr. Carter. And then now Ken, who, all these people are very integral, important part of the people in the community. Ken, even when he was a incredibly busy orthopedic surgeon, took the time to really help move us along and getting a smoke-free program in this county. And also the Falls campaign for elderly people falling. Thank you, Ken, and all the doctors we've had. We've also had nurses, and I'm not going to be able on our board. I'm not going to be able to talk about all of them. Vanessa, thank you for being willing to be on this board. And it brings to mind to me another incredibly kind, terrific person, Lottie Pugh, who was on our board for years. She was a school nurse in Benton Harbor schools at a time when we had started the school-based clinic at Benton Harbor High School. So I got to work with her on multiple levels. Terrific person. So one of the times, one of my sons played college football and was going to go to St. Xavier in South Chicago to play a game. And I knew from previous discussions that Lottie had gone there, and that's where she got her nursing degree. And I said to Lottie, I said, I'm going to Chicago this weekend to see my kid play a football game. Can I get something in the bookstore for you, a gift that I could give you from your school? I said, have you been back there much? And she said, no. I said, I'll bring you back something. And she kept saying, no, no, no. But again, being the type A personality I am, I kept pushing and pushing. And finally, she related to me privately a story which says a lot. When she was at St. Xavier in the 60s, because she was Black, she was not allowed to live in the dorm, along with one other Black student there. This is in South Chicago in the 60s. And to talk about, she was given a small stipend to arrive by subway. So when we talk about some of the work we're doing here and continue to this day, it's been going on forever, equity work remains to be an incredible thing that we're doing because combating racism is so important. And so last thing, I'll just say a couple of words about past medical directors. So there was for a very short while, there was a Dr. Hirschler who had done mission work in China. He was a Southwestern doctor. Very interesting. Someday I'll tell you about, he was a pilot. Someday I'll tell you about it on time now, but someday I'll tell you about a flight he took back from Traverse City with some of the staff from the health department. But Dr. Silvernail was here for many, many years, from 73 through 1999. And Dr. Silvernail also worked in Haiti. While there, he was the director of their tuberculosis program and their national immunization program. And he got to know Jean-Claude Duvalier, also known as the infamous Baby Doc, and he knew him personally. Now, Silvernail was definitely the ultimate type B personality, but in a spectacular stroke of brilliance, one day Duvalier asked him, "What can I do to keep my own children from getting sick?" Silvernail thought for a second and said, "Well, you can immunize your country, and that'll be the best thing you could do to protect them." And holy mackerel, Duvalier did it. And the number 2 most immunized country in the whole Western Hemisphere became Haiti because of Silvernail's conversation with Duvalier and then what he required. He actually required everybody to get a vaccination in Haiti back in the 70s and 80s. So that was Silvernail. He did some terrific work here. He was also on the international board of Compassion International, with worked with needy kids. And then just say a word about future medical directors. You're going to need a new one. I know one guy, Rex Gabaltica, who we've dealt with through the pandemic, who's a medical director of a nursing home. He's a good guy. We've known him well. He spent many years in China, but he's back now. He's a lot younger than me, so he could be around for a while too. He could give you some longevity. My only worry about him, however, and I must say this, is that we all know that Nikki got her MPH from Yale. So Rex got his MPH from Harvard. So whether we should have 2 Ivy Leaguers from 2 competing schools working together is an open question that'll have to be worked out. So in summary, I want to thank you, Board of Health, for allowing me this time I just took, the privilege of highlighting some of the past and the opportunity to have been your and continue to be your medical director. Thank you.
Well, thank you. You caught us flat-footed, so we're not at the point to laud you, but we will. So we'll get it together.
Thank you.
Thank you so much. Candy, I am looking at the time and wondering, and Nikki, whether you want Candy to do her report or what's your pleasure?
If it's the pleasure of the board, I think it would be. I don't think that Candy's presentation is going to take a significant amount of time.
Not that we don't want to hear you, Candy. So, yeah. All right. So,
you want me to move forward?
yes,
Okay.
please.
I'll make it brief. Just a couple updates on the clinics that we're continuing to run in alongside the COVID vaccination clinics. We're still keeping up with our MP clinics at both Niles and Benton Harbor sites, 1 day a week at each site. We are still open for RN clinics 1 day a week at each site. We are, as well as an IMS clinic 1 day a week at each site. And the other 4 days are allotted for COVID vaccinations because it just takes that much time. We have done some really cool work here in the past couple of months with our HIV program. And I believe that once we get things figured out and how we're going to move forward, you guys will all hear about that. I'm very excited about the work we're going to be able to do in Benton Harbor and in the surrounding towns and cities and townships with that, with the help of the state. So we've been working really closely with them at this time. COVID testing, the strike team, and I'll give a little plug in for Guy. Guy was with me when I first started, and that was almost a year ago. He pulled me along to start going out and testing with him. And so Guy and I became the strike team. So there you go. And we've been doing that since. We have not had to do it as much in the past, I'd say, month now. Testing offsite has been really limited. Not that there's just not the need anymore. So that's helpful. We're just not going out as much, which is really, really good. That means those folks are getting vaccinated. I'm sad to see Dr. J go. I'm very sad, as well as Lisa. I'm brokenhearted. It's only been less than a year that I've been able to work with them, and I find that to be very, very sad because I'm just getting to know them. But congratulations to both of you, and I know that you guys will enjoy your retirement. And we have a great team here at the health department, and the reason we run so well is because we all communicate with one another, and everybody has their role, and it makes it happen easier. So we could not do it without each other. So thank you all.
You, Candy.
Thank you too. Gee whiz, in the year that you've been here, what timing you had to join us. So any comments, Nikki or Courtney? Well, thank you. We're glad to hear that the programs are still continuing in other areas with the overwhelming work you're doing with COVID. Dr. Harrison, do you want to bring us up to date with the things relevant from the Berrien County Board of Health?
We are continuing to, well, first let the commissioners all express their appreciation for the hard work you've been doing. And, you know, we all receive positive comments on a daily basis, which is not always the case given our roles in the community. So we'll continue to watch what goes on in Washington and Lansing, some of the drama, and try and help you guys sort out what's going to happen next. We did pass a resolution urging the governor to look at things a little differently than she has in the past and focus on a regional approach to, you know, unraveling some of the restrictions. And so I think given what she just did, I think that would probably be about where the board, you know, because we're never of one mind. We would probably say that's a good step forward. But, you know, we do appreciate everything you've done, especially Dr. Johansson and his tenure with the health department. And we wish him the best. And also with Lisa, you know, because my relationship with both of them goes prior to being on the county board, and they're just great people, and I'll miss them both. So thank you. That's about, I'd be glad to answer any questions you might have of me, or ones I can't answer. I'll find someone that has the right information.
Thanks, Bob.
Yeah, any questions regarding the Board of Commissioners? So, all right, is there any topic that the board would like to discuss before we look at public comments?
Yes, I do have a question. We discussed it. This is Vanessa. Can you hear me?
Yes.
We had discussed it some time ago before we got involved in COVID to such a great extent. The topic is intercare, and at the time it was said that they were talking about discontinuing their OBGYN services, and I wanted to get an update on that.
So I don't recall any conversation about them. Courtney, do you about
I don't think
OBGYN
it
or
was
is this
OBGYN. I think it was the
MIH.
MIHP program. So the maternal infant health program, which is a home visiting model. They're still doing their OBGYN services.
Okay, thank you.
Yes.
That is true. Yeah.
So part of the discussion too, I mean, just because we are doing a little bit of forward thinking, the MIHP program and its absence in our community is definitely felt, and it's definitely felt very acutely right now. So that is something that pre-COVID we had definitely, oh gosh, I'm sorry, I just lost my train of thought. We had definitely been trying to think, is there a way that the health department could assist with that gap in the community or some other partner for assurance? That is something that's still in the back of our minds, but just not something we have the resources to think through right now. So I'm hoping that over the next several months, we'll be able to pick that back up in more earnest. But it's a home visiting program that somewhat parallels. It's different in how it's manifested and how it all works, but it's somewhat along the same vein of nurse-family partnership.
Oh, okay. Thank you. I misunderstood that original conversation. Thank you.
And just a quick note on that, Vanessa, is Miss Keena King, who was here last month. Sorry, the months go fast. I believe just last month. She is actively continuing, even through the pandemic, working with our partners at Spectrum Health Lakeland, as well as Intercare, to keep doing a lot of that forward planning. Clearly, we're all kind of in that focus of pandemic, but to that extent, that is a huge need still in our community. So there is still a lot of work going around of how do we fill that need, what is the need, and then what are the resources we need to meet that. So that's information in the upcoming months we can certainly bring back to the board.
Thank you.
All right, any other comments? We do have a sewage appeal. The sewage permits are up 100% according to Nick. It's been very unusual to be able to have permit requests during the winter time. So there's a great deal of a potential building going out there. So we'll continue on that. And so public comments, Jillian?
There is one. It comes from Audrey Lester, and she says, "All very impressive, and none of you look as tired as you must be."
Boy, she's nailed it, didn't she? So, all right. Well, thank you so much. If there's nothing else, we will reconvene on April